Doc, when it comes to teenage pregnancy, that's always one of the most difficult things to talk about. But it's also something that you always highlight. Every time you're here, you note na ito tumataas ang teenage pregnancy.
Yes.
Now, on the one hand, you could look at it in so many ways. Our youth that are out of school, having a lot of time. On the other hand, you also know that the youth are among the ones who are first to be locked in their homes. So less interaction. So what is it? What explains this rise in teenage pregnancy?
Well, the rise in Baguio and Zamboanga that was noted was probably in the lower teens, no, yung percentage increase. So it's not that high. What we're trying to find out is if it's among the younger, yung mas menor de edad that is happening. Because that's a sign of domestic abuse, domestic violence,
yes.
which everyone expects is going to happen more frequently given itong mga lockdowns. So that's something we're going to establish. Actually, we've been meeting with other agencies in government, and this is an area na walang kumikilos itong mga domestic abuse, violence against 10 to 12-year-olds who are actually victims of rape, pero no one is doing about it because they got pregnant. And I talked with PCW, Commission on Women, kanina lang with the executive director. And what we plan to do is ask DOJ to, let's say, call out their prosecutors to start prosecuting cases, no, ng mga 10 to 12 years old na nakikita lang sa birth certificate but no one does anything about it.
Okay.
So, diba?
So kumbaga prima facie dapat 'yon. Dapat prima facie dapat 'yon.
And they will take it up with the interagency committee on BAUSI. And they will start a program, I hope, soon. This is part of our package for teenage mothers and their children. So nanganak na 10, 11, 12-year-old, something must be done about it. At the same time, the SWD, DepEd, DOH, POPCOM will work together to bring them back to school, to provide health services, to provide yung early feeding, proper feeding para sa child kasi stunting is something that can happen to low birth weight na mga anak.
But Doc,
so multifarious approach.
But Doc, yung sa prosecutorial, pati yung interventions for these young mothers, these are all well and good. Unfortunately, these are after the pregnancy.
Yes,
what are some practical? On the preventive side, on the public health and community side, what are some realistic interventions that communities, families can be aware of and that can actually do to actually prevent it?
Well, actually, alam mo sa ating constitution, it's the parents who are tasked to be the primary providers of this information and this service. Pero most of the time, they are not doing the right job. And ganin pa nga yung iba that nag-abuse. So we have to engage parents more and more. So what we plan to do is, meron kami mga modules na for parents to get together with their teenage children. Pero at the same time, the parents have to get educated about how to do proper parenting, how to work with an adolescent, how to manage yung mga issues ng adolescents. So parents need educating also. So with DepEd, we hope to go into that. But of course, hindi naman estudyante ng DepEd ang parents. So we probably have to work to develop a program that really engages parents. In a way, medyo hinahabol natin yung issue. Yung mga barangay or community na maraming kaso ng teen pregnancy ng 10 to 14 years old, we have to start there. no? And then spread the word to more communities. So that will be part of our work with DSW, the DepEd, and how to create a program really for parents. And in a way, what we're talking about here is family development. No? Lahat tayo pinag-uusapan yung problema ng household, etc. Pero do we really have a program to assist families to be how to develop let's say itong mga teenagers, this is the first form of family, the earliest form, itong mga minor de edad. How are we going to help them become good parents, have um, uh, have a well capacitated population. Our population will increase in quality if we have good parenting, good family
Yes.
development. So,
Doc GP.
merong National Committee on the Filipino Family. So, we'll work with them on how to really develop a program for the family.
Doc, what about from the Catholic Church? Wala bang adverse reaction? Because I understand you were talking now with some Catholic Church leaders before, no? At medyo may parang cooperation na kayo nag-umpisa. Pero eto, ibang usapan pagdating sa contraceptive. They haven't changed their position on that. Sa kanila, yung
Yes, in a way.
lang, di ba? Anong
Yes, we have
reaction dito
agreed.
sa mga ginagawa ninyo ngayon from the church?
Yes, I had a meeting last month, no? Nandun yung bagong cardinal na appointed sa Manila, si Cardinal Vidal yata yun, coming from Brunei. Andun si Bishop Ledesma ng Cagayan de Oro and other Catholic Women's League, kausap ko. And I talked to them about the program. And I said, the program is going to promote both modern methods that are artificial and natural. And we have agreed not to criticize each other. So, yung kasi yung hinihingi ng mga tao. But if they want to promote natural, I will give a budget for them. Sabi ko, I'm ready to support yung mga natural family planning programs that they want us to support because nakalagay sa batas yun, that's part of our age. So I will support them. And they came away agreeing na, sige, we will agree to work together because responsible parenthood is common to the church and to the government. No? Responsible parenthood is in our constitution. The demands of responsible parenthood must be met by families, no, who have full choice on how to do it. So we have agreed that I do not have to have the support of the church when it comes to the artificial methods, but they will not criticize us when we do that because we are supporting them for the natural. So parang modus vivendi namin yan, not to criticize each other, but to work at the points that we can agree. Actually, I learned that from Secretary Johnny Flavier. Yun yung kanyang credo eh. If there's something we can agree on, I will work with you. We don't have to agree on things that we are debating about. No? Wag natin pilitin yung hindi pwede magkaroon ng agreement. So we're working well naman. I don't anticipate any problems from the church.